For the longest time, prenatal testing involved some pretty tough choices and invasive procedures. But then, a technology called non-invasive prenatal testing, or NIPT for short, came along and completely changed the game. So today, we're going to break down how this incredible leap in prenatal care actually works.
Everything we're about to talk about really boils down to this one single discovery back in 1997. It's pretty mind-blowing. Scientists figured out that little bits of DNA from the placenta are just floating around in the mother's bloodstream. That was it. That was the key that unlocked a totally new and much safer way to get a peek at a baby's genetic health.
So it begs the question, right? What if you could screen for some of the most common genetic conditions with nothing more complicated than a blood draw from your arm? Well, that's not a what if anymore. That's exactly what NIPT is.
And that brings us right into our first section. We're talking about a genuine revolution here, and it's all happening inside a single vial of blood. Let's dig into the science that makes this all possible.
Okay, so the star of the show here is something called cell-free DNA, or cfDNA. This is the stuff that NIPT is actually analyzing. And here's the part you really got to get. This DNA comes from the placenta, not directly from the baby. But since the placenta and the baby usually share the exact same genetic blueprint, this placental DNA works as a fantastic stand-in.
So how does it all go down? Well, it's a pretty cool four-step journey. It starts with a simple blood draw, anytime after 10 weeks of pregnancy. Then, in the lab, they separate out all that cfDNA, a mix of moms and the placentas. Step 3 is the high-tech part. They use amazing sequencing machines to read and count millions of these little DNA bits and sort them by chromosome. And finally, a smart algorithm looks at all that data and asks, hey, is there more or less DNA here than we'd expect for certain chromosomes? And that's what gives you a risk score.
All right, let's move on. The lab has done its magic, and we have a risk score. So, what are they actually looking for? What secrets can they decode from that one blood sample?
NIPT is mostly looking for things called trisomies. That's just the scientific term for when there's an extra copy of a chromosome where there should only be 2. The big ones are Down syndrome, which is trisomy 21, and the much rarer Edwards and Patau syndromes. And as a bonus, since the test can see X and Y chromosomes, you can often find out the baby's sex and screen for conditions related to those chromosomes too, if you choose to. Now, when it comes to accuracy, this is where NIPT really shines. For Down syndrome, which is the most common condition it screens for, the test is over 99% sensitive. Think about that. It means it correctly flags more than 99 out of every 100 cases. It is by far the best screening test we have for it.
And this leads us to what is, without a doubt, the single most important question in this whole explainer. If you get a result that says high risk, does that mean your baby definitely has the condition? The answer is a huge, unequivocal no. And understanding why is absolutely critical. Which brings us to our third and maybe our most important section. We have got to draw a very, very clear line between a screening test and a diagnostic test. They're two totally different things.
And this slide lays it all out. NIPT is a screening test. Its job is to assess risk. It's like a weather forecast saying there's a high chance of rain. It doesn't give you a final, concrete answer. For a definitive yes or no, you need a diagnostic test, like a CVS or amniocentesis. Those tests are like looking out the window and actually seeing the rain.
Okay, to really get what a high-risk result means, you need to know about something called the positive predictive value, or PPV. The easiest way to think about it is this. PPV answers the question, okay, the test came back high risk, but how often is a high-risk result actually correct? It's the probability that your positive screen is a true positive, and this number is a huge deal.
And this chart shows you exactly why PPV is so critical. For a more common condition like trisomy 21, a high-risk result is right about 75% of the time. Pretty high. But look what happens for the rarer conditions. For trisomy 18, it's less than a coin flip, just 45%. And for trisomy 13, it's under 18%. That means for trisomy 13, more than 4 out of 5 high-risk results are actually false alarms. This is precisely why you never, ever make decisions based on a screening result alone.
So let's get into those limitations a little deeper in our fourth section. Why do these false alarms happen? What else can go wrong? Because, understanding what a test can't do is just as important as knowing what it can.
So first off, sometimes the test just doesn't give you a result at all. It comes back as a no call. This usually happens because there just wasn't enough of the placental DNA in the blood sample for the lab to get a confident reading. It's called having a low fetal fraction, and it can happen for a few different reasons.
And what about those false positives? Well, there are some pretty fascinating biological reasons. Remember, the test reads placental DNA. Very rarely, the placenta can have a genetic issue that the baby doesn't. That's called confined placental mosaicism. Or you could have a vanishing twin, where DNA from a very early miscarriage lingers in the bloodstream. Even certain health conditions of the mother, like fibroids, or in extremely rare cases a cancer, can throw off the results by releasing their own abnormal DNA.
So this all brings us to our final section, putting it all together. With all this information, how do you take this powerful tool and make the right choice for your own journey? Let's just put it side by side. You have NIPT, it's a risk assessment, it's just a blood draw, there's zero risk to the pregnancy. Then you have something like a CVS. It gives you a definitive diagnosis, a yes or no, but it's an invasive procedure and carries a small but real risk of miscarriage. You can see why so many people choose to start with the risk-free option.
And of course, there's the practical side of things, cost. It can be pricey, but the good news is that insurance coverage is getting way better. That's mainly because major medical groups now recommend that NIPT should be offered to all pregnant patients, not just those considered high risk. That's been a huge game changer.
So if you take away one single thing from all of this, let it be this. NIPT is an amazing, powerful screening tool. It's a first step. A high-risk result is not a diagnosis. It is the beginning of a conversation with your doctor or genetic counselor about what to do next. And that next step is always talking about a confirmatory diagnostic test.
And that kind of leaves us with a final big thought. NIPT have opened up a window into pregnancy we could have only dreamed of a few decades ago. So the challenge for all of us now, for patients, for doctors, for society, is how do we use this incredible flood of information to empower people, to help them make informed choices without getting totally overwhelmed by it all?